Hello, welcome this evening for another edition of Bustmob Live. My name is Dr. Hunter. I am from the Amelia Raleigh group. And if you happen to be watching this on, say, one of the other platforms, such as Instagram, please check out our Facebook group, Bustmob main page. There's lots of interesting and useful information to kind of help you on your surgical journey. There are other patients who kind of have been through the surgical experience themselves who can kind of give you their tidbits and kind of tell you what worked for them and kind of give you some advice and kind of just some support along the way. So again, check out the Bustmob main group. And then otherwise, we got several questions here to go through, and actually some really good questions. So I'm excited to get started. As we're doing this, please post any of your other questions that you may have as we kind of are working through the process, and we'll get from there. All right, so let's see. Find more questions. All right, so first question is from Lindsay, and it says, I've seen different standard tummy tuck incisions. Heard someone say that they're requesting a C cut straight across. Is there different cuts, or is the incision shape based on the skin that needs to be removed? So standard tummy tuck incision is pretty much the same. You're going to have an incision where usually the 2 points on the edge are pretty close to the kind of your hip bones, and the incision along the bottom is going to come just above, say, the mons pubis, which is, the pubic bone, which is kind of the hard bone, obviously, in the lower aspect, just above the mons of the vagina. Or some people will just do it based off of a measurement that's above kind of the top of the opening of the vagina, the introitus. And so really the two different ways that I kind of think about this is that some people will do a smooth U, like a kind of a smiley face. And some people will do kind of a little more sharp points at the bottom, where it is a bit more like, here, I'm drawing. Why don't I just draw? It's actually easier that way. So the two kind of standard incisions that I usually see with the tummy tuck are either a smooth line at the bottom, or, as I said, some people will use a more smooth line, or use a kind of a more square, kind of more jagged points. The reason for doing either of those is that the smooth line, I think, tends to close better. But people like the jagged point because they thought that it would kind of keep the scar a bit more low, kind of in the central aspect. I don't know that I think that that's true, but that just lies the reason. So anyway, is there different cuts or is an incision based on the skin that needs to be removed? Those are just the two types. The same amount of skin should be able to be removed either way, but that's kind of your standard two incisions. Next thing. From Alicia, my plastic surgeon never measured my base width diameter. I told him I wanted upper pole fullness and got 650 cc extra high profile under mentor gummies. I'm only 8 days post-op, so not sure if I got what I wanted yet. But does extra high profile automatically mean upper pole? Most would say Mod Plus gives more upper pole. Now I'm worried. For these, get this question actually a lot, and so I actually think it's a good question because it's something that gets into the details of implant selection that I think sometimes people have more information than they know what to do with. So extra high profile sounds awesome because it just sounds extra high, right? So it makes you think you're going to get something extra. Really what an extra high profile means is that the implant is narrower and it has more projection, right? And so we go through this before. I'll take a prop as an implant, right? And so when people start talking about profiles, right, one of the things you have to think about is that high profile means that the implant is, I'll do it this way, the implant is more narrow, yet it points off the chest higher, whereas a low profile or a moderate profile, even moderate plus, is more wide, but doesn't quite poke off the chest as much. And so if I were to put that then onto my chest, right, if something is a high profile, ultra high profile, that means it is more narrow from side to side, as well as more narrow from top to bottom. but it pokes off of the chest more. Whereas if something is a more of a Mod Plus profile, it has a bit wider diameter and doesn't quite have as much projection. And so I would not say that just by getting an extra high profile, you get more upper pole fullness. I kind of would say that you get more projection, which is when you look from the side, it's going to point out more, but I don't know that it's going to be any higher. It's hard for me to kind of say what it would look like on you without seeing necessarily any pictures or anything like that. But I would say that in general, for the same volume, a wider implant is probably likely to give you more upper pole kind of fullness. But again, it depends on the frame. And 650 cc's is a pretty big implant. And so you kind of start to get into much smaller differences between the profiles as you get a little bit larger. So hopefully you got what you wanted, and hopefully it gives you the look that you want, but extra high profile does not automatically mean more upper pole fullness. So I think that's something that we can definitely rule out for sure. All right, next question. Katie, should I try to lose weight before a tummy tuck and be at your ideal weight? What prevents swell hell after a tummy tuck? Nothing prevents swell hell after a tummy tuck. It kind of is just part of it, right? And so like, swelling is basically your body's response to trauma. So you get swelling whenever you roll your ankle. You get swelling with kind of all these kind of general injuries that aren't surgery. And so then if you imagine that you have some sort of larger surgery, tummy tuck, liposuction, things like that have a ton of trauma, right? Swelling is to be expected and it hangs around for a long time. Some people are lucky enough that the swelling goes away faster, but it just depends on the person, right? And so should you lose weight before the tummy tuck and be at your ideal weight? That question really just depends on the patient, right? And so if someone comes in and they are interested in a tummy tuck and their goal weight is 30 pounds less than their current weight, I kind of ask them in general, like, are you kind of dead set on reaching this goal weight? Like, are you going to reach that weight come hell or high water? And if that's the case, then I say you should lose that weight before you have surgery. At least you want to be within 10 pounds of kind of your goal weight, because if you lose 10 pounds after surgery, you'll still look pretty good. Your skin usually retracts pretty well with that and really without too much change. But if you lose a significant amount of weight after surgery, 20-ish pounds, somewhere around in there, I worry that your skin doesn't retract as well. And I worry that then you'll have loose skin that then you will be unhappy with, and then we're kind of back in the same place. The reason why I say it depends on the patient is because you also have these ideal weights, right, that are based off all these general metrics that people have versus kind of the patient's own weight. Because some patients, even if they are a little bit above their ideal weight, they may say, yeah, I'd like to lose 30 pounds, but if I don't, it's fine, right? I'm really more interested in what I look like than what the scale says. And if that's the case for those patients, sometimes I tell them it's okay to go ahead and proceed with it. And they just know that if they lose a significant amount of weight, then we just may be coming back for touch-ups at a later point. And they tend to be okay with it. It's just about having a conversation about kind of really where they think their weight is going to settle. And if this surgery is indeed going to be a motivating factor for them to kind of help them with exercise and working out and feeling more confident and kind of workout clothes and just feeling more confident in themselves to be able to do those things. So there's no solid answer for that, other than losing a significant amount of weight afterwards can change your results. Moving on to the next one. Brenda asks, with a drainless tummy tuck, how does your body get rid of fluid? So that's part of when you do a drainless tummy tuck, what we do is we try to suture down the skin to the abdominal wall, because the idea is that you want to close down the space, right? And so what happens is that anytime you do the tummy tuck, you're going to have muscle, and then you're going to have some fat, which we did kind of try to liposuction out or cut away, and then you're going to have skin. And so what happens is then your body makes a space in between the muscle and kind of the underlying fat. And so you can use a drain to suck out that fluid. Or if it's drainless, I can suture and kind of close down that space. It's like putting a lid on a container, right? And then kind of pressing it down. That's another way for me to just prevent your body from having any area to be able to accumulate a lot of fluid. You can still sometimes build up fluid in those areas, and then we sometimes have to drain it, but it's not that common. And most people tend to do well with just doing the drainless and kind of having some external compression in the form of a garment. And so how does your body, specifically how does your body get rid of it? You have these little lymphatic channels, and your body just reabsorbs a certain amount of fluid kind of each hour or each day. And so usually with the drainless, we can keep that fluid under that amount. Then you don't really have any other issues with it, and you're able to kind of easily reabsorb that. So that's that. So next question is Linda says she has a breast lift, breast aug, and lipo to the bra line back in October, and she's gained 10 to 15 pounds since then. Is this normal? So this is also another thing that actually comes up pretty commonly, or not. It's not uncommon, so I'll put it that way. And so a good thing to help with weight loss or weight gain after surgery is the garment, because it helps keep down on swelling. But then also just the question of, is it normal? Yeah, right? And so imagine you have this surgery, you're somebody who's super active, right? You go to the gym multiple times a week, you are up, you're running, you're dieting, doing all this stuff. And then for 6 weeks, you can't do any of this stuff, right? You stop exercising, your diet probably hurts just a little bit because you're not up and kind of cooking and kind of running around and kind of eating the same things you were before. And so you can gain a little bit of weight from that, right? You take swelling, you take a change in your activity, you take a change in your diet, and you just take the trauma from surgery, again, they kind of can change some hormones and things like that. And so a little bit of weight gain is actually okay. After we then kind of remove your restrictions, you're doing well, we then kind of let you go back to all your normal stuff. And for most people, once they get back to their normal stuff, then they're able to then lose the weight again, right? They don't necessarily, it's not weight that you're going to keep on. So if you're close to surgery, you have some weight gain, I say don't fret. I say it's normal. Eventually, once you get back to doing all your normal stuff, gym, diet, out of that kind of post-surgical period, I expect you to get back to your normal weight and even get beneath your normal weight, right? Particularly for places where you've had liposuction or like tummy tucks and things like that, where we actually have taken away a significant amount of volume and a significant amount of tissue. So that's kind of the general answer for that. Short answer, yes, it's normal. Next, from Jenny, we have, what are some non-surgical ways to address loose skin on your thighs without having a thigh lift? And this is also then comes from Gigi. So, typical, straightforward surgical way is a thigh lift, but that actually comes with a large scar. And so the idea is, and how do I kind of get my skin tighter without having this large scar of the thigh lift? A couple of things that you can do really involve around like just kind of trying to tighten the skin. And so you have ultrasound therapy with things like alt therapy, right? And the idea is that it can kind of warm up the skin, warm up some of the collagen that's underneath or in the skin, and that can kind of somewhat tighten the skin. You can use radio frequency energy, which is like Morpheus 8, or you like Thermi. And those things, again, try to tighten the skin and kind of try to tighten some of the tissues that are just underneath the skin to help kind of contract the skin and help tighten it. You can use, next thing is like intermittent, like pulse light is another thing that kind of sometimes people will use with like laser. And so that's something else to kind of help tighten the skin. All these things are really for people who have small amounts or small areas that they're treating, right? Like, it's good for things like a little bit of loose skin under the chin, a little bit of loose skin on the arm, a little bit of loose skin on the thigh. If you have a significant amount of loose skin, then these things aren't going to be effective for you really, because the area is just going to be too large and you won't be able to get rid of that much skin. You won't be able to tighten that much skin. You really just have to kind of remove it or excise it in the form of a lift. But those are things you can do if you have small areas and you really are looking for something that's non-surgical. And those are usually going to be found usually on, at least for our practice, on the med spa side. And for a lot of other practices, it's going to be in the med spa, kind of hence non-surgical aspect. All right. Next question. We're moving right along. And again, if you guys happen to have any questions, please post them to this live, and we'll make sure we go over it. But if not, we'll kind of keep hitting all the ones that have been added before. So Juliana, how soon after breast surgery can I go swimming in basically public pool or ocean? 6 weeks, 4 to 6 weeks. Some people at 4 weeks, after about a month, feel like the incision is pretty well healed, and so they'll allow you to kind of get into the swimming pool. It's kind of where I was before, kind of starting here. But here we can pretty much say 6 weeks, because we put tape over the incision to kind of help with some of the incisional healing. And then once those tapes are off, as long as the incision is closed, you can't get water inside of it, I'm okay for you to swim anywhere really you want to. Problem before those 4 to 6 weeks is that if you get water inside of the wound, you set yourself up for an infection, which becomes a major problem, right? And so Sometimes those are people's issues with kind of having a breast augmentation or something like that in the summer because they want to get in the pool. I tell people it's still fine as long as you're covered right, really to just get waist deep. But again, you just don't want any total submersion for about a month, at least a month for that. Next is I felt some small crackling sounds around my implants when I was recovering, and everybody said it was normal. What causes it? So there's a little bit of crackling that kind of you can get around your implants, and sometimes people can hear it. Is you get a little air inside the pocket because obviously everything is open, and then when I close it, if you have air that's trapped in there, that air mixed with the fluid that's inside can sometimes make some strange noise. It goes away. Your body reabsorbs the air, your body reabsorbs the fluid. That stuff will go away, but it is kind of weird for a little while. But you just have to know that it's normal. There's nothing that's gonna cause any long-term issues, so nothing you have to worry too much about. But it's a mixture of air and water, just to give you an explanation as to why you're having it. And then sometimes too, when people have the fluid, like they feel like they can feel it sloshing around for a little while in the beginning, and that's because we put a lot of fluid inside to wash the pocket out with a lot of antibiotic fluid, just to keep everything clean. And we try to remove all that, but sometimes you leave a little bit behind. And so if it sloshes around for a couple of days, that's okay. Your body will reabsorb that as well. All right, moving along. Average wait time between consult and surgery, and what's the deciding factor between a lift versus no lift with the breast augmentation? Average wait time, can't give you a solid answer because it depends on the practice, right? Some places are booking out, let's say it's October. Some people are booking out until like January, February now. Some people are just booking out to the next month. Some people are booking out, if they're fortunate enough, maybe even 4 or 5 months. So it really just depends on the practice. It depends on how many like OR days they have, how many consult days they have, just how many patients they have in general. So it depends. If you really are curious, I encourage you to contact whatever office it is that you are interested in, potentially being a patient at or getting more information from, and then just asking, right? And if there's a particular area, a particular time of the year that you want to like have surgery because you either have downtime, you have vacation, whatever, then I encourage you to kind of book and schedule that earlier rather than later, because again, those time slots do fill up. So. And then the next part of the question is deciding factor regarding a lift versus no lift with breast augmentation. This is a question that's as old as time, and I'll tell you this one is not always very clear. So the one thing that most people tend to use is ptosis, right? And so nipple ptosis is a specific thing that people talk about. And so that is, does your nipple sit above the fold or does it hang below the fold? Some people will talk about like a pencil test, right? Like, can you put a pencil underneath your breast and can you hold it there? And if you can, then you might need a lift or probably need a lift. And if you can't, then you don't, right? It's pretty straightforward who doesn't need a lift, right? Your nipple sits high on the chest. You have no breast tissue, A cup or even double A, just an augmentation. Pretty straightforward, easy. People who have nipples that are pointing down to the ground, right? Like from breastfeeding or just kind of just their natural kind of breast formation, just whatever it is, that's, again, pretty straightforward. The one that you have questions about that isn't always easy, and you just kind of work this out with your surgeon, is my nipple is at the fold, or my nipple actually sits higher on my chest, but I have some extra skin that does hang over, and I am, with the pencil test, I can hold a pencil. I don't think there's a right answer, is my honest opinion for that. I work it out with the patient, right? I will tell you that if you do have the point where like you can hold the pencil, or if you have the extra skin and you tell me, I want as much upper pole fullness as I can get. I want it to be super round. I want it as close to that almost half melon look as I can get. I don't want any breast tissue kind of that settles or looks kind of more natural in that setting. Then you need a lift, right? Because that's the only way for me to get rid of that tissue at the bottom and make you have more upper pole fullness. However, some women, right, like a more natural look. They like that it sits a little bit lower. They like that it's a little bit more of a teardrop. And they don't want the scars, or they don't want their implants or breasts sitting too high on their chest. They don't want all that upper pole fullness. And for those people, they don't need the lift. Really what they just need is to fill out the envelope. I do often tell people that if you don't have a lift and you do either have some extra skin or your nipple is just a little bit lower, then you probably need a little bit of a bigger implant to be able to stretch out the skin, excuse me, but you don't have to have the lift. Where I do think people get into a problem is that if the nipples do point down or are close to pointing down and they just put in a huge implant, what happens is then the breast falls off of that implant and they haven't done themselves any favors, or you as a surgeon have not done them any favor, because ultimately they'll just be coming back to then talk to you about a lift. So those people who I think fully need it in the beginning, I just have a conversation about what it is that they want and what the risks are of kind of doing both of those procedures. So that's kind of my general take on kind of when you do a lift versus no lift with just a breast aug. And again, if you wanted just to lift without the breast augmentation, if your nipples are a little bit low or you just want more, you feel like you have extra skin, you can do a lift just with your own tissue really at any time with that. All right, let me jump down now to Brienne. And Brienne says her base width is 13.5. Imagine that's centimeters. And she wants to know, will getting her max recommended CC in ultra high profile over the muscle help fill out my gap even just a little? So ultra high profile, again, we're going back to this, right? Remember, as we talked about, the ultra high profile, what that does is it's projection, right? So it doesn't really have anything to do with the width, right? In terms of lateral breast tissue, kind of lateral curvature, or side boob, or kind of cleavage, right? It doesn't really have to do with it. It has more to do with profile. It has more to do with projection, right? That's what the ultra high is for. Ultra high, not ultra tall, ultra high. And so over the muscle, I do think actually sometimes over the muscle can help with a little bit with cleavage, but you help with the gap, but there is a stopping point, right? Still with that. The reason why I say that you can push it a little bit more is because when it's under the muscle, I got to stop at your muscle, right? That saves us from, it prevents us from getting like symastia, right? Which is the big thing with when you're trying to push that gap, which is why you just kind of have to have an honest conversation with patients that I can't make your cleavage any more than kind of what it naturally is, right? I have to stop at your breastbone. I have to stop at your sternum, because if I try to push that and I lift that skin off of your sternum and you get a symastia, that is really, really hard to fix. And so for some women, the breast is just a little more laterally centered on the chest, right? You see that some people's nipples are just a little more laterally centered on the chest. And I think that that also is fine, and that's also a beautiful result. It's just everybody has these different kind of breast footprints, so like where the breast is on the chest, and again, that's okay. But just to answer the question, over the muscle, I do think can help, because I do think you can push it just a little bit, but you have to be careful again, because I think it has a higher risk of symastia. The ultra high profile fill out the gap, I don't think it helps that much, in my professional opinion, because again, I think that helps when you're looking from the side. Does that give you more projection? But from front on, does it do anything for the cleavage? I don't think so. But when people are narrow and they want more volume, that's where ultra high profile really comes into play, because it lets me put a large volume, like the first question, it lets me put 650 cc's on somebody who has a really narrow chest, right? All right, next is moving on to Taryn. Is it normal to feel fluid moving around your implant? How long does it last? And so this kind of goes back to the question we had not too long ago. Yeah, it's normal to have some fluid around the implant, particularly in the beginning, because that's often done by the surgeon, right, as they're washing out the pocket. And also, it's just as you get some swelling, that should go away within a period of a couple weeks, right? A couple weeks to just maybe even sometimes with some of the air, a little bit kind of closer to a couple months. But after that, you shouldn't really start to have it. If you don't have any fluid, if the fluid has been all resolved, and then say several months later or several years later, you start to feel like there's fluid around the implant, then that's called a seroma, and you start to have more problems, right? So you don't want late fluid around the implant, but if you notice fluid in the beginning, that is okay. Again, as I'm saying this, there's always the caveat, there's always aren't any fevers, chills, redness, drainage, things like that, because again, that would make me be more concerned about fluid around the implant if you have those associated symptoms. Next, Janet wants to know, what is the risk of losing feeling in the nipple after a second lift or a revision? I tend to like numbers, although for some of these things, I think numbers aren't as useful, right? So I think you can probably find literature that will probably say risk of loss of nipple sensation for breast augmentation is probably somewhere around 5%. So you also see some things that are lower than that, up to maybe about 10%. And so on a revision, depending on what type of revision you're doing, if you're just going back through the same pocket, I'd say your risk really probably isn't as high, because we don't go through any more breast tissue, right? If I'm just pulling out the implant and changing the size, I'm only going through my same incision, which I've already been through, and sometimes we'll open up the pocket, but sometimes you don't even have to do that. You're just changing the implant. I'd say your risk of loss of nipple sensation from that isn't that high, other than you do get some change in sensation just from stretching the tissue, but there aren't going to be any nerves or anything that are going to be cut or injured in that regard. If I'm needing to do things like a lift, or I'm needing to do a significant amount of capsule work, right, then it's possible that your risk can go up just a little bit. So I'd probably say I'd stick for around 5% if you're looking for a certain number. But in general, I just tell people the risk of that is low. It's not zero. Some people do have a change in sensation. Some people have a persistent numbness. But some people also have an increase in sensation and get a little bit of hypersensitivity for a short period. But again, both of those, I expect those to go away over time for most people. Next, Caitlin wants to know, how long after lift and augmentation is it safe or recommended to sleep flat on your back? For me, I'd say pretty much as soon as you finish, right? Like, I don't want you sleeping on your belly, and I do think that sleeping on your back with a little bit of incline, I think it's helpful for swelling. But if people wanted to sleep straight on their back on night one, I don't think it's a problem per se. I'm okay with that. I think with a little bit of elevation helps with some of the swelling. But if you're more comfortable sleeping on your back, because really what I want is you to just sleep. I want you to feel rested. I want you to feel invigorated. I want you to be comfortable. And so with that, you can just sleep on your back. And if that makes you feel comfortable, I have no problem with that. It's laying on your chest, I think, that becomes more of the issue. And I have you wait a while for that. One, because you can't feel it in the beginning with the incisions. It's just not going to feel good, and it puts a lot of pressure on the sutures. So next, we got Jocelyn. She wants to know, is there any way of correcting a huge gap between the breasts and creating cleavage? For a lot of people, just adding the augment creates cleavage, right? Just adding the implant, because adding volume pulls the skin off, and makes it appear as though it's a little bit more of a cleft. It's cleavage, a little bit deeper, kind of in between the breast, the breast tissue. We talked about this a little bit before. Over the muscle, I think, helps push it a little bit, because you can push the center cleavage, I think, maybe just a little bit. But I wouldn't dare say that I think over the muscle always has more cleavage than under the muscle. I don't think that's true. I just think that when you're under the muscle, you have a hard stopping point, right? You stop where the muscle inserts. And when you go over it, you can push that a little bit more. But again, I think that it is dangerous to push it too much, because if you over push that and you over dissect, then you can create a symastia, which is where the breast implants are basically touching each other. And that's a problem. That's a uniboob, and nobody likes that. And that's really, really hard to fix. And so again, this is where we kind of have to have an honest conversation with people. I'm super big on expectations and being honest, because I think that if we can be honest with you, then that can help set your expectations for what you're going to get after the surgery, right? I think that the surgeon that's doing it, if you have a really wide breastbone, should just be honest with you and say, like, I don't think I'm going to be able to get you super tight cleavage, but I think I can make what you have better, right? But I have to stop for safety reasons at a certain point, and that will limit a little bit about where I can place the implant. And so also, I think that in terms of helping to create more cleavage, that's where we go back to this whole high profile Mod Plus. For me, from my professional opinion, I like to use a wider implant to help with more cleavage, because it's a wider implant, right? It makes more sense, right? If this is your chest, I can either use something that is this narrow, or I can use something that's this wide, right? Which one do you think is going to give you more roundness in the center, right? The one that's wider. So those are kind of the conversations that I think are important to have, and that I like to have with my patients per se. All right, next. Kristen wants to know, can you remove a hamartoma at the same time as a breast augmentation? And will any part of a full tummy tuck surgery be covered by insurance if you have an umbilical hernia? So can you remove a hamartoma at the same time as a breast aug? You can. I don't know that I would recommend it, because one, you don't really know what the size of the thing is that you're going to be removing. And a hamartoma is a benign growth. So that makes it a little bit more okay in that regard. But I would say, if I had a patient who had one, I would advise them to go and get it removed, have it removed, and then have it checked by path, right? Have it checked by path to make sure that everything is fine, make sure it is just a hamartoma. And then once all of that is done and that complete workup is finished, they don't need any other monitoring, need nothing else, then I'd say we'd go forward with the breast augmentation. I don't know that I would combine the two in that situation. I don't know that I think that that's useful. I'd rather just manage the growth and then do the breast augmentation at a later point. As far as doing the full tummy tuck surgery, will it be covered by insurance on umbilical hernia? I've actually done those where I've had some insurance portion covered, and the insurance, by and large, every once in a while somebody can sneak a tummy tuck through, and I don't really know how they do that, but I will tell you it is not common, and given that I have also done insurance review in the past, it is usually very strongly against all insurance company policies. And so sometimes people can sneak it through. But what will happen is that if you have a hernia that's going to be repaired under insurance, what happens is that as they start the cosmetic tummy tuck portion, they start that time and it runs, right? And then once they are then ready to switch to the hernia repair and the general surgeon comes in or the plastic surgeon fixes it, they stop that cosmetic time, they start the insurance time, they fix the hernia. Once the hernia is done, then they're supposed to restart then the cosmetic portion of the procedure. Sometimes people may fudge on those numbers a little bit. I'd be very hesitant about that because if you get caught, it's called insurance fraud. But sometimes people do. And so in general, no portion of the tummy tuck would be covered under insurance because they always consider that cosmetic. Now, you can have some debates about that, whether or not that's always true for some people who have like back pain, have significant diastasis, etc. But the way it is now is considered cosmetic. So that is your general answer for that. All right, let me see if I got any questions up here. If you guys have any, please add them. I'll make sure I go over anything before we hop off. Let me just refresh, make sure I'm not missing anybody or anything. All right, let me refresh this one more time to make sure I'm not missing anything. Few more comments. Give me 1 second. I'm just trying to make sure I'm not missing anything or leaving anybody's question out. Okay. All right. Well, it has been an absolute pleasure. I always enjoy these. If you happen to think of any questions afterwards, you may go ahead and go in and post them at a later point. We usually try to find them and then add them on maybe to another live, but we'll be doing this a lot, me and kind of some of the other surgeons. We enjoy kind of doing this with you guys, answering all your questions, make sure everybody feels like they're educated and ready to go for anything that they're thinking about. Again, it's been a pleasure. Everybody have a good night, and got Thanksgiving coming up, so happy Thanksgiving. You guys otherwise have a good night.